A very good afternoon. I am Professor Dr. Vidyadhar Sardesai. I am a professor and head of the department at Bharati Vidyapit Medical College, Dermatology Department, Pune. And I'm also a consultant dermatologist, having an experience of last 30 years in this field. Today, I'm going to talk something about a very common skin condition, namely psoriasis. We all have heard about psoriasis. You read a lot about psoriasis in the literature. You read a lot about or hear a lot about psoriasis on the media. And overall, there is a general fear about psoriasis among lay people because the main issue is the cosmetic problem. And the second issue, of course, is the symptoms with which it is associated. Now, psoriasis is a fairly common skin disorder which affects about 2 to 3% of the people in the world. And this percentage is the same, more or less the same in Indian population also. So we see a lot of psoriasis cases in day-to-day clinics, in day-to-day practice. What is this skin condition? The most important thing is it's a totally non-infectious condition. It's a skin disorder wherein the turnover of the skin cells in the skin increases, and that results in formation of red colored patches on the skin, accompanied with shedding of the skin, which is seen as scales, which is typically described as silvery white scales. So many patients do get itching along with these skin patches. Some patients might not get itching. But this is a very common skin condition, and the patients are mostly worried because of the itching as well as the sight of it, the cosmetic part of it, because nobody likes to have scaly lesions or scaly patches on the, say, palms or on the elbows and so on, which are visible parts of the body. Now, this condition is said to be of a genetic origin. That means an individual is predisposed to get psoriasis genetically. But if he or she is exposed to certain triggering factors, then and only then this condition can be manifested or can be clinically seen. Now, what are these triggering factors for psoriasis? Number one, and the most important according to me, is stress. Everybody is under stress nowadays, but sometimes, individuals' way of coping with the stress sometimes it's very difficult. And such amount of stress, an extreme degree of stress, might trigger psoriasis in those individuals who are predisposed to get psoriasis. Second is certain medicines. And among the medicines, one of the very commonly medicines is a one which is given for blood pressure, what is called as antihypertensive, among the class of drugs that is called beta blockers. Many of the patients are treated with beta blockers like tenolol or metoprolol, and these drugs are known to trigger psoriasis. The third is certain infections, mainly in the throat, and this is commonly in the younger population. So if a person or a youngster is likely to get recurrent throat infections, then such patient or such person is likely to get a type of psoriasis which is most commonly called as guttate psoriasis. And then there are certain other factors also which are known and unknown. Weather is one of the very important factors because many psoriatics get exacerbation during the winter and their lesions subside during the summer, whereas the other way around also a few patients can get it. Now, as far as the area of involvement is concerned, there are certain parts of the body which are said to be areas of predisposition, and they are mainly the elbows, the knees, the scalp, the lower back, and of course sometimes the palms and soles. So these are the areas which are very commonly affected, mainly because they are areas of friction or they are areas of recurrent trauma or recurrent hurt. So these are the areas which show these lesions. Now, as far as the types of psoriasis are concerned, the common type, what is called as psoriasis vulgaris, is the one which is manifested as well-defined red-colored patches which are covered by silvery white scales. So this is called as the plaque type of psoriasis or psoriasis vulgaris. In dermatology, vulgaris means common. The second type of psoriasis is a guttate psoriasis. Now, guttate means like raindrops. So these are small lesions and they are more commonly seen in children and youngsters who had a history of recurrent sore throat, which I told you just now. The third type of psoriasis is called as pustular psoriasis. Now, in these, there are certain pus-filled small tiny lesions over the body. And important thing is these pus-filled lesions are sterile. That means they don't have any bacteria in it. And this is one of the type of psoriasis which at times may be associated with a significant morbidity, and very rarely it might be even sometimes fatal. So this is the one which is to be treated aggressively. There's another type of psoriasis, what is called as inverse psoriasis. And inverse psoriasis means the other way around. That means the areas which are not commonly involved get involved. And these are the axillae, that is the armpits, and the groins. And these are the areas or the inguinal areas or the genitals where lesions or scaly lesions are seen. So this is called inverse psoriasis. Then sometimes a patient or a person might get what is called as localized nail psoriasis or localized scalp psoriasis. That means there are a lot of scaling only over the scalp, or there are a lot of changes in the nail which really disfigure one's nails a lot. Another type of psoriasis is a localized type. It involves only the palms and soles. But this is equally bad. I mean, it really affects the quality of life a lot. Because imagine having a lot of scaling and lesions on the palms and soles, which is going to affect the day-to-day life. Finally, psoriasis is sometimes associated with joint involvement. And this is called as psoriatic arthritis. And at times, the joint involvement can be so severe that it can cause a lot of stiffness, it can cause a lot of deformity, and it can really cause a lot of interference in day-to-day life. And mainly the joints which are involved are what are called as the joints of the fingers or the toes, or sometimes the central spine. And this, again, type of psoriasis needs to be treated aggressively. So these are some of the types of psoriasis. And there is one type what is called as exfoliative psoriasis or psoriatic erythroderma. That means when more than 85 to 90% of the body is involved with this psoriatic lesions or psoriatic process, then it is called exfoliative psoriasis. And this is something which needs to be treated properly in a hospital because it may lead to several other complications. Of course, this is not a very common type of psoriasis. So in short, we have just seen the different types of psoriasis. Now, how to approach a case of psoriasis? Basically, important thing for a person is if he or she has psoriasis, he or she should consult a dermatologist, a properly qualified dermatologist, because only a dermatologist can properly manage your skin condition. Now, important thing about investigations in psoriasis are there are certain blood investigations which are done for the management part of it, or there are certain skin investigation done like a biopsy to confirm the diagnosis. But mostly the diagnosis is clinical, and many a times you really don't need to do a biopsy. Only in uncommon variants you might need to do a biopsy. Now, as far as the management is concerned, important thing one should remember is one, psoriasis is not cured, but you can control it very effectively. So it's a condition like, say, diabetes or blood pressure or thyroid, where one needs to take treatment continuously or needs to take drugs lifelong. But in psoriasis, you might not need to take drugs lifelong. Maybe you will have to monitor the condition for a long time. Here, it's called as a period of remission, wherein the entire skin is free of skin lesions, maybe due to treatment, or maybe due to automatic remission when the weather improves and so on. Or there is something called as exacerbation. Like in winter, suddenly the lesions might exacerbate. Or there is a very major stress somewhere, some death in the close relative, or some problem as far as the business is concerned. Then there might be sudden exacerbation of lesions. So this is equally important. You have to know these terms as remission and exacerbation. And the goal of treatment to have as long remission as possible. Now, as far as treatment of psoriasis is concerned, the first step is the lifestyle modification. And in the lifestyle modification, one needs to be careful about his weight. One needs to be careful about the diet. One needs to meditate so that his stress level can go down. And since psoriasis is associated with comorbidities like heart problems, diabetes, or metabolic syndrome, lifestyle modification plays a very key role in managing psoriasis. Now, as far as the treatment proper is concerned, remember, if the skin lesions are involving less than 10% of the body area, then only local medications can help. But if it's more than 10% body involvement, then local medications along with oral medications or injectable, what is called as systemic therapy, is indicated or is required. As far as the local medications are concerned, important thing is to keep one's skin dry. So a lot of moisturizers or emollients are always prescribed. The simplest being, say, simple oil, or a lot of emollients, cold creams which you get, or sometimes doctors prescribe certain specialized moisturizers and emollients or humectants. Then there are creams which are either having steroids, which can be used under medical supervision. Patient should not use on his own. There are certain creams with vitamin D analogs. There are certain creams with content called as retinoids, salicylic acid, and all these creams are to be used under doctor's supervision. But mainly these are used for localized lesions, less than 10%. Otherwise, the skin is just kept soft by moisturizers. And among the oral treatment, there is a gold standard drug, what is called as Methotrexate. So after proper screening and after proper monitoring later on, Methotrexate can give a very good remission in psoriasis. Then there are certain other drugs like cyclosporine, acitretin, vitamin D analogs, and so on. But these are to be strictly taken under medical supervision, not on your own. There's another way of treatment, and that is called as the phototherapy, wherein either ultraviolet A or ultraviolet B rays are used to treat psoriasis. So there are special UVA lights or UVB lights which are having in the chambers or special lights, and they also help in controlling psoriasis. The recent advances as far as psoriasis is concerned nowadays is what are called as biologic drugs or biologics. And these are the drugs which are targeted drugs which act on the basic cause of psoriasis, and they give an excellent long-term remission. And that's why they are very frequently used nowadays. Of course, the major drawback is costly. They are quite costly. The cost is there, and a lot of monitoring is required because they act on the immune system. But if taken under proper medical care and medical supervision, they give you a long remission, even as long as 6 months to 1 year and so on. Even certain newer drugs like JAK inhibitors have also come, like apremilast and all. And all these drugs overall have really revolutionized the treatment of psoriasis. So to summarize, psoriasis is a non-infective skin condition. It is seen in a person who is genetically predisposed to get psoriasis if exposed to certain triggering factors like stress, infection, and so on. Thirdly, it's a condition which is easily diagnosed on clinical examination, no need of a skin biopsy every time. Fourthly, lifestyle modification, local medications, and the systemic medications, especially the advancement like JAK inhibitors or apremilast or biologics. This is all the recent way of treating psoriasis. So in short, psoriasis is no more a dreaded condition. If properly managed, it's a condition which you can control very well, and you can lead an absolutely normal, stress-free life. Thank you very much.